Hello and welcome. Today, we'll explore a nursing care plan for diverticular disease using the ADPIE, which stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation. This approach helps us organize and deliver patient-centered care effectively. By the end of this lesson, you'll learn what diverticular disease is, what causes it, and how to tell the difference between diverticulosis and diverticulitis. We'll go over the common symptoms, how it's diagnosed, and how you, as a nurse, can assess, plan, and care for clients using the ADPIE process. We'll also look at simple ways to teach clients how to manage their diet and lifestyle to prevent future problems. Let's get started. Let's begin with a brief case study. Mr. Ahmed is a 63-year-old male who presents with lower left abdominal pain, bloating, fever, and occasional constipation. He has a long-standing history of consuming a low-fiber diet and leads a sedentary lifestyle. These are important factors in the development of diverticular disease. Diverticular disease includes two related conditions, diverticulosis and diverticulitis. Diverticulosis involves small pouches, diverticular, in the colon wall. When these pouches become inflamed or infected, it progresses to diverticulitis. Diverticular disease develops over time, and several risk factors contribute to its onset. First, aging is a key factor. The condition is more common in people over the age of 40, as the colon wall tends to weaken with age. Lack of physical activity is another contributor. A sedentary lifestyle slows down bowel function, increasing the risk of constipation and pressure in the colon. Obesity adds extra pressure inside the abdomen and may also increase inflammation, which affects colon health. One of the most well-known causes is a low-fiber diet. Without enough fiber, stools become harder to pass, leading to straining and increased pressure in the colon. Having a family history of diverticular disease may also raise your risk, suggesting a possible genetic component. The long-term use of NSAIDs like ibuprofen, or steroids, can irritate or weaken the bowel wall, increasing susceptibility. Lastly, smoking has been linked to an increased risk of diverticulitis and complications due to its effects on blood flow and inflammation. Together, these factors highlight the importance of diet, lifestyle, and medical history in understanding and preventing diverticular disease. Diverticulosis often doesn't cause any symptoms. Most people don't even know they have it. But when symptoms do appear, they may include bloating and changes in bowel habits, such as constipation or diarrhea. When diverticula become inflamed or infected, the condition progresses to diverticulitis. This is when symptoms become more noticeable. Common signs of diverticulitis include abdominal pain, especially in the lower left side, fever, nausea, and vomiting. Patients may also experience constipation or diarrhea, and in some cases, there might be blood in the stool. These symptoms signal the need for medical evaluation and proper management. If left untreated, diverticular disease can lead to serious complications. These include abscess formation, bowel perforation, peritonitis, which is an infection of the abdominal lining, and fistulas, or abnormal connections between organs. Some patients may also experience rectal bleeding. To diagnose the condition, healthcare providers begin with a physical examination and blood tests to check for signs of infection or inflammation. Imaging is crucial. The most accurate tool is a CT scan of the abdomen to confirm diverticulitis and identify complications. A barium enema may also be used to visualize the colon, but it's typically done after the acute phase has resolved. A colonoscopy might be performed later for further evaluation, though it is usually avoided during active inflammation to prevent the risk of perforation. Treatment depends on the stage of the disease. For diverticulosis, the goal is prevention. This includes eating a high-fiber diet, drinking plenty of fluids, and avoiding straining during bowel movements. For diverticulitis, mild cases are managed with antibiotics and a low-residue or clear liquid diet to allow the bowel to rest. Pain relief may be provided using NSAIDs or acetaminophen after starting antibiotics. For more severe cases, patients may require hospitalization. Initial treatment typically involves keeping the patient NBM, nothing by mouth, and starting IV antibiotics to control the infection and rest the bowel. If complications occur, such as abscess formation, fistulas, bowel obstruction, perforation, or peritonitis, surgical intervention may be necessary. This may involve removing the affected portion of the colon, especially in cases of recurrent diverticulitis. Long-term management of diverticular disease focuses on preventing flare-ups and promoting healthy bowel function. Clients are encouraged to follow a high-fiber diet rich in fruits, vegetables, and whole grains to soften the stool and reduce pressure in the colon. Regular physical activity is also important, as it helps maintain normal bowel movements and supports overall digestive health. For individuals with chronic constipation, fiber supplements or stool softeners may be recommended to ease straining during defecation and prevent complications. Consistent follow-up and adherence to these lifestyle changes play a key role in reducing the risk of future episodes. During assessment, Mr. Ahmed reported cramping pain in the left lower quadrant, bloating, a mild fever of 38 degrees Celsius, and abdominal tenderness. On examination, bowel sounds were reduced in the lower abdomen. He also complained of alternating constipation and diarrhea, a low-fiber diet, and has a history of hypertension. A CT scan confirmed the presence of multiple diverticular with localized inflammation, indicating diverticulitis. The client presents with a heart rate of 88 bpm, respiratory rate of 18 bpm, blood pressure of 130/85 of a millimeter of mercury, temperature of 37.9 degrees Celsius, and reports abdominal pain rated 6/10. On palpation, the abdomen is tender in the left lower quadrant without rebound tenderness. During the physical assessment, the client reports tenderness in the left lower quadrant of the abdomen, which is a common sign of diverticulitis. Blood tests show an elevated white blood cell count of 12,800 per cubic millimeter, indicating an inflammatory response. A CT scan of the abdomen confirms the presence of multiple diverticular with localized inflammation, consistent with a diagnosis of diverticulitis. Based on the assessment, we identified several nursing diagnoses. First, acute pain related to inflammation of the diverticula. Second, imbalanced nutrition due to altered gastrointestinal function. Third, a risk for infection from localized inflammation. And lastly, a knowledge deficit regarding appropriate diet and disease management. Our goals for Mr. Ahmed are clear. First, we aim to reduce his pain to a score of 3 or below within the next 48 hours. We also want to ensure that his body temperature remains within the normal range. Additionally, we plan to help him restore regular bowel movements within 3 to 5 days. Before discharge, it is essential that Mr. Ahmed fully understands his dietary requirements to support long-term recovery and prevent recurrence. To implement the care plan for Mr. Ahmed, we begin by closely monitoring his abdominal pain, bowel sounds, and temperature to track any changes. We'll administer antibiotics and pain medications as prescribed to address the infection and discomfort. Nutritionally, we'll start him on NPO status to rest the bowel, then gradually reintroduce clear liquids, followed by a low-residue diet, and finally advance to a high-fiber diet as tolerated. In addition to clinical care, we'll focus on patient education, highlighting the importance of a high-fiber diet, adequate hydration, avoiding straining during bowel movements, and engaging in regular physical activity to support long-term bowel health. Once our nursing interventions are in place, we evaluate the outcomes. Mr. Ahmed now reports a reduced pain level of 2 out of 10 within 48 hours, and his body temperature has returned to normal. His white blood cell count also shows improvement, indicating resolution of the infection. Importantly, he demonstrates a clear understanding of the required dietary and lifestyle modifications. At follow-up, Mr. Ahmed reports regular bowel movements and adherence to the care plan, indicating successful management. Let's quickly recap the nursing care plan using the ADPIE approach for diverticular disease. Assessment: we identified symptoms such as abdominal pain, bowel irregularities, and signs of inflammation. Diagnosis: key nursing diagnoses included pain, imbalanced nutrition, risk for infection, and knowledge deficit. Planning: our goals focused on relieving symptoms, educating the client, and regulating bowel function. Implementation: we provided medications, adjusted the diet, and offered client teaching on lifestyle changes. Evaluation: we measured outcomes, pain was managed, bowel function was restored, and Mr. Ahmed showed better understanding of how to manage his condition.